Hi, my name is Jane Morton, and I am going to talk you through our series of slides about how Medicare works with Indian Health Service. If you have tribal health, why you might want to get Medicare too. So, ready? I work for the Western Montana Area 6 Agency on Aging. We're located in Polson, but we have offices, we serve Lake, Lincoln, Mineral, and Sanders counties and the Flathead Reservation. We can help you with Medicare, answer your questions, help you get signed up. I'm a SHIP counselor. The Montana State Health Insurance Assistance Program trains and certifies people to help you with Medicare issues. And to get to our office, you can call the statewide toll-free number 1-800-551-3191. We also have a number that's specific to just our office, 1-800-266-4188. And we have a local number, 406-883-7284. And again, we have counselors in Lincoln, Mineral, and Sanders counties as well that we can put you in touch with if you live out in that area. You can also call the local Social Security offices for information, and their phone numbers are listed here. A lot of people with tribal health or Indian Health Service think, well, I get everything I need from Indian Health Service. Why would I get Medicare? This is just to explain a little bit about why you might want to have both. First of all, Medicare is primary to Indian Health Service. That means they have to pay their share before Indian Health Service. So if you get something done at Indian Health Service, Medicare has to pay their share before Indian Health Service has to pay. So that way the Indian Health Service is able to not spend as much money, so then they have more money available for tribal needs. If you're still working and you have employer-sponsored health insurance, usually Medicare is secondary to that. In other words, your insurance pays and then Medicare comes in and pays secondary. What is Medicare? Well, Medicare is a health insurance program for all Americans who are 65 and older. That's the bulk of the program. But also people under 65 who have either end-stage renal disease, Lou Gehrig's disease, asbestosis if you lived up by Libby, or you're on Social Security disability for 24 months, then you're eligible for Medicare. Medicare has 4 main parts, Part A, B, C, D, and then also Medigap insurance. In Part 1, we're mostly going to talk about Part A, the hospital. In Section 1 of this video, we're going to talk mostly about Part A, hospital insurance, and Part B, medical insurance. A lot of people kind of have Social Security tangled up with Medicare in their mind. That's probably because the years that you worked and had payroll taxes taken out, Social Security is the one that collected all of that. And they determine eligibility for Medicare. Once you sign up, they send you your card. They also have a program that helps pay for Part D if you can't afford it. But once you're signed up for Medicare, Social Security doesn't handle any of the billing or coverage or payments. That all goes through the Centers for Medicare and Medicaid. When do you sign up for Medicare? Well, your initial enrollment period centers around the month you were born. So it's 3 months before your 65th birthday month, that month, and 3 months after your 65th birthday month. Now, for those still working and on employer-sponsored health insurance, they may choose to keep that insurance and delay their Medicare, in which case you have a special enrollment period for 8 months after your employer insurance ends. And so you can sign up during these enrollment periods. This is just a graphic that gives you a better picture of the initial enrollment period. This blue here is the month you turn 65. If you sign up in the 3 months before you turn 65, your Medicare starts on the 1st of that month. So I was born November 17th. If I sign up in the 3 months before November, my Medicare will start November 1st. If you wait until the month of your birth or in the 3 months after, you can still sign up for Medicare and not have a late penalty or anything, but the start of your Medicare will be delayed, sometimes to the month after, sometimes for several months after you turn 65. If you miss your initial enrollment period or your special enrollment period, and we have people come in on a pretty regular basis that say, oh, I turned 65 a few years ago, but I didn't do anything about Medicare, and they can still get on Medicare. So if you miss your enrollment period or your special enrollment period, you can still sign up during the general enrollment period, and that's January, February, and March in each year. The trouble with that is your coverage doesn't start until July 1. So if you go more than 12 months without Medicare or other employer insurance, then you may have a late penalty. So the general enrollment period is a chance if you miss the others, but you really don't want to miss them because you really don't want a late penalty. So how do you get Part A? Well, most people are automatically enrolled for Part A. If you already get Social Security benefits or railroad retirement, or if you've been on Social Security disability for 24 months, they're going to automatically enroll you in Part A. And you'll get that Medicare card in the mail 3 months or more before your 65th birthday, or 3 months or more before your 25th month of disability, if you're on disability. If you do not meet the automatic criteria, in other words, you're not collecting your Social Security yet, then you need to actively enroll, and you can call the two Social Security offices. Or the best way is in this box. You can enroll online at the Social Security website, ssa.gov. Anyone can go on this website and do it for themselves, or we help people with this a lot. We use the same website and enroll people for Medicare. So you can call us and we'll help you with that. Whether you're automatic or you enrolled, you'll get your Medicare card in the mail. This is an example of what it looks like. It's not a big plastic card like a credit card or a driver's license. It's the size of your Social Security card, which is smaller and on flimsy cardboard. So a lot of people have thrown this away, mixing it up with all the junk mail that comes when you turn 65. And we can get it replaced, but it's kind of a pain, and it's a lot better to not throw it away. So watch your junk mail. Before you throw any mail away, look to make sure it's not your Medicare card. Most people don't pay anything for Medicare Part A. Because they have a work history or their spouse has a work history. of at least 40 quarters, or equivalent to about 10 years. And most people fit into this category, either they or their spouse. And you don't have to worry about a late penalty either. So no premium, no late penalty. If you don't have 10 years or more where you paid payroll taxes, or your spouse did, if you want Part A, you can sign up for it and pay a monthly premium. If you choose to do that, if you're not, if you don't qualify for premium free, you may have a late penalty for this if you miss those enrollment periods. Okay, what does Part A do? Part A is called hospital insurance. It helps pay for hospital stays, skilled nursing facility, home health care, and hospice. I'll just go ahead. Part A, like I said, doesn't have a monthly premium. It does have a deductible of $1,408 if you're put in the hospital. Now, if you go in the hospital and pay that deductible, and you're in the hospital somewhere between 1 and 60 days, you don't pay anything else. However, if you're there for a long period of time, so after 60 continuous days you're still there, for day 61 through day 90, you pay $352 a day as your copay. If you're still there after 90 days, for days 91 through 150, your copay is $704 a day. Now the tricky thing about this deductible up here is it's a per benefit period deductible. Now when you get in the hospital, as long as you stay there, that's the same benefit period. Doesn't matter how long you're there. But if you're hospitalized and then you get out, and you're out of the hospital for 60 days or more, and then you go back in the hospital, that's considered a new benefit period. So you will have to pay this deductible over again. And in 2020, it's $1,408. You'd have to be pretty unlucky to be hospitalized and then out for 60 days or more, hospitalized again, out for 60 days or more, hospitalized again. But mathematically, it could happen that you would have to pay that benefit or that deductible several times during a year. Medicare Part A also pays for a skilled nursing facility care. This is only if you have been hospitalized for a minimum of 3 days and the doctor prescribes some rehabilitation care. Part A will pay up to 20 days in full. If you're still there after 20 days, for day 21 through 100, you have a copay of $176 a day. After 100 days, your Medicare Part A benefit is used up, and it'll all come out of your pocket. And again, this is only for rehab care following a minimum 3-day hospital stay. Medicare does not cover long-term care. It also does not cover care if you only need personal care. If you don't need any medical care, but you go to a skilled nursing facility for a time and you only need personal care, Medicare Part A doesn't cover that. Medicare Part A also pays home health care if it's ordered by your doctor. And home health care is intermittent skilled care that's ordered by your doctor. And this home health aids also is skilled care like wound care, changing a dressing, or IV treatment that you need, not personal care. Medicare Part A won't pay for it if you need someone to come help you with housework or cooking while you get well. For durable medical equipment like a wheelchair, for example, you usually pay 20% of that cost. Medicare Part A also covers hospice care if you're diagnosed with a terminal illness and you're expected to live for 6 months or less. The doctor can certify you for hospice care. If you're still living after 6 months, the doctor can recertify you. So you're not limited to only 6 months coverage. As long as you're terminal and you're expected not to live for very long, the doctor can recertify you as many times as necessary. How do you start Part B? Enrollment in Part A and B usually occurs at the same time, but if you enroll online, there's an option to say, I do not want Part B. If you're automatically enrolled and they mail you a card that shows you have Part B, there are directions on the back of that card of how to decline Part B. Remember, Part B is the one where you have to pay a monthly premium. Medicare Part B covers most medically necessary services that are not inpatient. So doctor's appointments, labs, outpatient care, medical equipment, ambulance. This last one here, annual wellness visit and personal prevention plan, is a little bit tricky because it does cover those at 100%. But if you are at your annual wellness visit and you complain, say, of problems breathing, and they do a chest x-ray, that is considered diagnostic. Those kind of things are not part of your annual wellness visit. Medicare Part B does not pay anything toward eye exams, eyeglasses, hearing aids, foot care, dental care, and this one is pretty important. Medicare Part B doesn't pay long-term care. If you have to move to a nursing home, Medicare does not cover that. A lot of these things are covered by Indian Health, but Medicare Part B does not cover those things. As I said, there is a monthly premium for Part B in 2020. The monthly premium is $144.60 a month. If you're in the higher income brackets, you may pay more than that. Most Americans just pay the standard $144.60. Part B does have a deductible. In 2020, it's $198. It is an annual deductible, so once at the beginning of the year, you're responsible to pay $198 before Medicare starts to pay. Now, Indian Health would pay this. Then once you meet that deductible, Medicare Part B generally pays 80% and you pay 20%. If you have Indian Health, Medicare pays 80% and Indian Health pays 20%. If you don't have Medicare Part B, then Indian Health has to pay 100% of this cost. So you can see it saves the Indian Health Service quite a bit if you have Part B, because they will pay 80% of your costs. Now, if that monthly premium is difficult for you to afford, there is a program called the Medicare Savings Program that will pay for that monthly premium. There are different levels in the Medicare Savings Program. And the qualified Medicare beneficiary for the very lowest income will pay for Medicare premiums, both A and B, and all deductibles or co-insurance. If you are in the special low-income Medicare beneficiary or the qualified individual levels, then it will pay for your Part B premium. The Medicare Savings Program has income limits and resource limits. To get in the Medicare Savings Program, you must have an income of less than $1,436 a month, and resources less than $7,860 if you're a single person. Now, resources does not count your house or your car. They look at money in the bank, other real estate you may own, other vehicles you may own, any other property besides your house and your car goes towards your resources. If you're a couple, the income limit is $1,940 a month, and the resource limit is $11,800. Medicare Part B covers a lot of preventive benefits at 100%. Mammograms, colonoscopies, pneumonia shots, it pays 100% of those costs. Again, if you just go to Indian Health, they pay for those things, but Medicare doesn't help them with the costs. Some typical scenarios of people that have Indian Health. Scenario 1 is about Bob. Bob has only Medicare Part A and Indian Health Services. Bob gets really ill on a Friday evening and he goes to the emergency room. He's admitted to the hospital for several days, but because it's a Friday night, Indian Health Service is not notified until Monday. So Indian Health Service denies coverage for the days that don't meet their 72-hour notification rule. Since Bob doesn't have other coverage, he can't pay the hospital bill, and so it ends up going to collections. If instead Bob has Medicare A and B and Indian Health Service and gets ill on a Thursday evening, Friday evening, he goes to the emergency room and Indian Health Service isn't notified. Medicare Parts A and B pay primary, so they pay for all of his days. Plus they pay their part on the days that Indian Health covers, and then Indian Health just has to pay what's left over. So Bob is not left with an outstanding balance. He doesn't owe any money. Scenario 2 is about Mary. Mary only has Indian Health Service, and she's lived alone successfully for many years, but now she needs to move to a nursing home. Her modest resources are quickly used up by the nursing home costs, and she now needs long-term care Medicaid. But you can't get long-term care Medicaid unless you have Part B. After a lot of maneuvering, she's qualified for Medicare Savings Plan and then put on Part B, and that gets rid of her late enrollment penalty, which is pretty substantial. And then she can apply for long-term care Medicaid. And finally, after lots of stress and worry on her and her family's part, and lots of maneuvering by everybody else, then she can get long-term care Medicaid. The other scenario is that Mary has Medicare A and B already and Indian Health Service. So then when she needs to go to the nursing home, it's a smooth process for them to help her apply to get long-term care Medicaid to pay for that nursing home. Scenario 3 is about Pat. Pat only has Indian Health Service. He's applied for Medicaid, or I guess Pat's a girl, excuse me. Pat has applied for Medicaid, and she finds out that Medicaid will pay for her to have Medicare Parts A and B. And any copays, oh wait a minute, I got ahead of myself. First of all, Pat only has Indian Health Service, and she usually gets all the care and medication that she needs from Indian Health Service. However, she has a problem that she needs to go to a specialist in Missoula, and she needs to go through the tribal approval panel for this procedure. And she doesn't want to do that. So she just decides to live with the problem even though there's discomfort and inconvenience because she doesn't want to do that approval panel. Or if she applies for Medicaid and Medicaid helps her pay for Medicare Part B, then she can go to that doctor that's not part of Indian Health Service, and Medicare covers that and Medicaid picks up the balance. So then she doesn't have that condition anymore because she can get it taken care of without going through that tribal approval panel. So that's the end of, oh excuse me, I need to back up. That's the end of section 1 about how Part A and B work with tribal health. Again, we're the Area 6 Agency on Aging, and we can help you sign up for Part A and B.